Hello, good morning, everyone. Thank you for joining us for today's webinar, the first virtual webinar for 2026. And we'll be talking about effective communication to strengthen your organization. So our speaker today is Miss Chloe Jang, and she's a communications coordinator for the Sickle Cell Awareness Group of Ontario with over 10 years of experience supporting nonprofit organizations through strategic communication, grant development, and program design. Her work focuses on helping organizations communicate complex health and social issues in clear and practical ways. With a background in academic research and community-based programs, she brings an evidence-informed approach to storytelling, advocacy, and stakeholder management, working closely with patients, families, funders, and partners. So just a few housekeeping rules. Microphones will be muted during the presentation. We'll have a Q&A session after the presentation. The camera use will be disabled for the webinar. And then the chat box should be used for relevant comments, questions, or clarification related to the discussion. And then please note that this session will be recorded for documentation purposes. Participants are encouraged to be mindful of confidentiality when sharing experiences or perspectives. Okay, Chloe, you can go ahead and start. Thank you.
All right. Thank you very much, Daniela, for the wonderful introduction. Good morning, afternoon, or evening, everybody. Thank you so much for taking the time out of your day to join this session. As Daniela mentioned, we are going to be covering effective communication. But before we get started, I'd really love to know three things if you're willing to share. One, where are you joining us from? Two, which organization are you joining us from? And three, if you know approximate size of your organization. I'm very curious to see kind of like what type of sizes we have for the organization. So like how many people are on your team, that kind of thing. So today, the purpose of this workshop is to help you learn how to communicate with clarity across your teams and with community partners. This is to reduce confusion, delays, and missed opportunities, as well as to strengthen trust with patients, families, partners, and funders. What we're going to cover today is really four parts. The first part is about the importance of communication, highlighting things about why communication fails, pillars of effective communication, and communication with key stakeholders. Part two is about internal communication, so how to strengthen your teams. Part three is about external communication, how to strengthen your relationships with um, external partners, as well as part four with your free resources and tools. So just as an icebreaker, my question to folks is, how much does communication cost US businesses annually in US dollars? Do you think it is A, $120 million a year, B, $12 billion a year, C, $60 billion a year, or D, $1.2 trillion a year? You can put your answer in the chat. So I see 120 million, 60 million, B, 12 billion, another B, another C. Okay, A. All right, all right. So lo and behold, the answer is actually D. It actually costs $1.2 trillion per year for US businesses. And this is according to a poll research that was done in 2025. So this just expresses, I guess, the gravity of what miscommunication can do to not only a business, but also what it can do for something much smaller than maybe a business, but to nonprofits as well or organizations. Exactly. So Nancy's saying it's surprising, but you factor in delay, reworking, missed opportunities, and those costs can add up quickly. So some more statistics. 64% of business leaders and 55% of knowledge workers believe that effective communication can increase team productivity. 28% of employees report that poor communication is the number one reason for not being able to meet deadlines, and nearly 70% of the workforce could be more productive with an effective communication process implemented at work. All of this is translatable to organizations of really any size. But to understand how we can effectively communicate, we need to know what communication is. So, communication is the act or process of using words, sounds, signs, or behavior to express or exchange information or to express thoughts, feelings, etc. to another person. So, really highlighting here that there are many ways for us to be able to communicate. And the key thing here is that there's actually an exchange of information, that there's someone on the other side receiving the information that we are intending to submit. So, what is effective communication then? Well, this is actually the ability to exchange ideas, data, perspectives with clarity, purpose, and adaptability in order to influence, build trust, and drive results. What does this look like? Well, with effective communication, we're able to have quicker problem solving, better team retention, stronger partners, relationships, professional public image, increased productivity, and higher trust, not only within teams, but with external partners as well. So I want folks to reflect on these two questions. If folks feel comfortable, you can feel free to leave your questions or answers in the chat. So question one is, think about the last time a message that you sent was misunderstood by somebody else. What happens as a result of that communication failure? So we have one expression in the chat saying, I assume people had the same background context that I did, which led to confusion about expectations and next steps. Another person says, I didn't clearly state the deadline or action required, so people interpreted the message differently. These are both excellent examples of things that pretty much happen on the daily basis. It doesn't necessarily confine to your work relationships. It can also be in your personal relationships too. The other person missed following the steps that needed to happen. All right. So it seems like due to these miscommunication mishaps, the outcome that you were expecting didn't necessarily happen. Maybe it caused a delay of work. Maybe it needed a couple more meetings in order to rectify the situation. But essentially, you've noted many key things that can happen as a result of a communication breakdown or failure. So, the question for folks now to consider is, why does communication fail? Melissa also adds, there was lots of confusion as a result of it, frustration from staff members, and can sometimes lead to assumptions or gossip. Exactly. And this can have long-term implications on the relationships you have with these people as well. So, what can we do to consider why communication fails? There's really four pillars to consider. The first is about content of your message. Maybe there was too much information, so people didn't read your full message, or it was too difficult to digest, or information overload, or there was too little information. There was vague expectations, vague details. People didn't really know what to do with the information provided. Or, like some people have mentioned in their experience, there was no clear ask or expectations. You send a message, but you don't have what is the result or action that needs to be taken as a result of this information. Or sometimes you have language barriers, right? This can look like actual different languages or also cultural differences in the way that people communicate. Or there could be a lack of candor or transparency. Maybe you say in your message that it needs to be done urgently, but people don't understand how urgent the situation truly is, so people don't take action on it. Another reason could be the method that was used. So perhaps you used the wrong channel. This could be uh, you sent a message via text, but someone wasn't expecting an email, right? Or like some folks have mentioned, you made an assumption that people all had the shared knowledge or background information necessary to take a particular action, but some people maybe did not. Another thing is that you could have sent one message to everyone and not clearly said who this message was for or who was to take responsibility for the action. This happens a lot when we CC a lot of people on an email. Or potentially used complex technology or ineffective tools that not everyone is comfortable, familiar, or trained on. And then another possible reason is the timing. So potentially there was no follow-up, or it wasn't done in a prompt manner, or you did last minute messaging and people missed messages as a result of that. The last piece here is tone. So cultural or personality differences can lead to different interpretation of text. Maybe some people might find that a message is very cold or very warm, but really the intention behind the message that was sent wasn't really meant that way. There could also be a lack of sense of urgency or lack of sincerity, and people might take it the wrong way. Or in the context of speaking face to face with somebody or over Zoom, where you can see people's expressions, there might have been missed verbal cues or misinterpreted verbal cues, non-verbal cues, apologies. So I really like this quote by George Bernard Shaw. The single biggest problem in communication is the illusion that it has taken place. So what does that really mean? It's like you think that you have delivered a message to another person successfully, but either that message was not, I guess, absorbed in the way that it was intended, or vice versa, someone communicates to you and you're kind of lost in that conversation. I just want to highlight some things that folks have mentioned in the chat. So communication can also fail because of assumptions instead of checking for understanding, right? That is also highlighted in the method section. And then tone can also be misinterpreted, especially in written communication. Exactly. So um, people express themselves a little bit differently. I personally like to use very short, succinct sentences. Some people may interpret that as, oh, she's very abrupt. Another thing is missed deadlines, frustration, duplicated. Oh, no, I'm rereading something. Oh, and duplicated work can lead to a loss of trust within teams. So now that we know now we know how communication may fail, let's redirect and talk about what does effective communication look like. There's really four key steps to implementing effective communication. It's know your audience, choose the right channel, evaluate your tone, language, and the length of the message, and then call to action. So this first point about knowing your audience. So when you're thinking about, okay, I need to construct an effective message for somebody, well, who is that somebody, right? Is it your colleague? Is it your boss? Is it a government official? Is it a hospital partner? Is it a patient or client, right? Knowing who you are speaking to can effectively frame the way that you would like to construct your message because you need to think to yourself, what is the most important thing that they need to know right now? Right? Because there's so many things that you could potentially include in your message, but to really make sure that you're driving home the key points, you need to think about what is most important. So you might want to tailor your key points based on the audience member that you are speaking to. For example, your board members might be focusing on risk or oversight. Your funders might be wanting to hear from you on basis of outcomes and accountability. Your patients and families that you support, maybe they're looking for reassurance or a clear message. So the key takeaway here is that tailored communication can improve your understanding and your trust. So a quick example of how we might implement something like this. So the same message, but you might be framing it differently. An example that some folks here might have experienced in the past. Let's say you're trying to sell tickets for people to attend your fundraising event, right? You might frame your message a little bit differently depending on the person that you are speaking to. For example, you want to invite some industry representatives. You might say something along the lines of, this event is an opportunity for your team to engage directly with patient communities. Your presence shows commitment to improving care and building trust. The angle that you're taking here is that, well, um, as a partner, you want to show up for the community, right? You want to show that you care, and therefore, as a result of that, the community can trust you more. For families, you might tailor your message to be, the event brings families together to share experiences and support one another. Your attendance helps to strengthen our community and support future programming, right? This is aligning that everyone might have a shared goal for why they want to come here, that this is an opportunity to relate to people that understand what you are going through. For government officials, you may say something along the line of, this event offers an opportunity to meet constituents, hear directly from families affected by this condition, and your presence supports informed decision making and community engagement, right? So you're kind of speaking the language of, yeah, you want to build relationships with your constituents so that you can do the best job you can while you're in office. The second piece is about choosing the right channel. So in order to choose the right channel, you kind of need to know what your options are. So there's really three major forms of communication. You have your written communication, you have your verbal or spoken communication, and then in the asterisk, you also have your nonverbal communication because that can also convey a lot of information in a very short amount of time. So to choose the right channel, you need to ask yourself, does this need discussion? Does this need documentation? And does this need urgency? And that can help inform what you're going to do next. So, common tools that we use and when to use them. So, email is excellent for when decisions need to be made, when follow ups need to be made, when it's a fairly when it needs documentation as well. So a lot of times we say, oh, make sure you send that in an email so that you have the email train, like email train. This is really helpful when information needs to be stored and passed along to other people. It's very easy to look it up within your email system so you know the exact date, the time, who was corresponding on it, and you can use this sometimes to guide decisions. Also use it as evidence if ever needed in the future. Be like, oh, actually, no, I did send this email to you. I can follow up about it, right? Other tools you can use are on a similar vein is text or messaging apps. This is usually when you have a sense of urgency, such as you text someone to remind them about a meeting, or if there's like an urgent change, oh, hey, instead of meeting at 2 o'clock, we're meeting at 3 o'clock. These are the types of things that you can use, and there's lots of apps that can be helpful for that. Meetings and phone calls. So this is really helpful when you need discussion. And this can help with alignment of decision making, redirection, or if there's any conflict. Typically with conflict, it's easier to parse through the the underlying reason for conflict when we are able to hear the inflection of tone when people speak or see the cues on people's face to measure authenticity, sincerity, and then also maybe underlying messages that might not be very clear in a text or an email. This Another thing is visual tools. So if you're wanting to communicate a lot of information in a very short period of time, things that are helpful are flyers, one pagers, infographics. This can be really helpful when you're doing your promotions or if the person that you are trying to communicate to may not always communicate back to you very quickly, right? So if you post something up on a wall as a flyer, right, then you're hoping that they will contact you via the email or the QR code, something like that. You might not have instantaneous communication. Last thing here is letters and documents. So this is incredibly important for any kind of formal communication, invitations, requests, agreements, policy changes, things like that. Now, of course, you can use a combination of these tools as well, depending on what the purpose is. Next is tone, length, and language. So with tone, regardless of what your message is, it's important to have respect. It's important to also be direct in your language and clear. Now, depending on what your message might be, sometimes you want to take a more formal approach using more formal language, formal sentence structure, or if you're communicating something very quickly, then maybe you want to use informal language, informal sentence structure. The tone you could also use could be more assertive if let's say you're asking for something, if a deadline is approaching and you need a document, you can be more assertive. You can be more easygoing if let's say you want to follow up on a message or build a partnership with somebody, or if it's a first reach out and you want to make sure you're coming off as friendly and approachable. The other thing is the language that you use. It's important to use plain language or lay language, avoiding super technical jargon or vague words. It's also important to acknowledge language barriers and take active measures to account for those. So, for example, if you know that the patient population you serve predominantly speak English and French, then having translation of messages would be incredibly helpful. We'll talk about language translation tools a little bit later. Length. So sometimes people have different opinions on the length of appropriate length of a message. Again, it depends on the formality of the message you're sending as well. But typically, if it takes longer to read the message than to act on the message, then it's probably a little bit too long. If it is too long, what you can do is maybe you can move it into like a more formal document, like a letter, so that people will take the time, recognize the formality, and read the entire thing. Or if you think that the message can be more concise, then you can shorten the message. Or if you think that, there's too many action items or too many things to act on here, you can split your message up into multiple messages. All right, I really want to make sure that we highlight the importance of nonverbal communication because this is often overlooked when we talk about interactions with other people. Your body, your eyes, your voice can convey a lot of information with or without you knowing. So, for example, with body language, um, be mindful of how, your shoulders are. I'm leaning towards you right now. I'm trying to stay engaged versus like very far back, disengaged. Crossing your arms, for some people, can mean that, you're disengaged. Crossing your legs can also mean that too. Both of those are closed body languages versus more open body language where your posture is back, you're leaning forward. Um, um, your eye contact is also very important. So where you're looking, if you're making eye contact, if you're speaking with somebody over Zoom, if you can, it's very common to look at the screen because you're typically engaging with the content. But if you can look at the camera every now and then, it usually improves engagement. There's also interesting cultural differences with what body language can mean. So pointing at things or bowing and stuff like that, there are cultural differences as well to be mindful of. So don't make assumptions if someone is doing some kind of body gesture and you assume that it's rude. Sometimes it could be a different a cultural factor. Other pieces of gestures. So gestures are incredibly effective tools to engage audiences. So when you're giving a speech, if you want to indicate size or direction, you can use your hands. Like it was this big, it was over there, it was back then. Very effective ways to keep audiences engaged as you are speaking, especially for long periods of time. Um, you can also use your head, right? Your head can gesture when you nod, when you shake your head. Um, Things that some people might do but not realize is some people might over gesture. So a lot of people may unintentionally have gestures with their hands that actually don't add value. So they might gesticulate a lot like this, but what am I adding value with when I'm doing this many, many times? For some people, this can be distracting. So if people like to talk a lot with their hands, they might want to, put it in their lap, put it on their side in order to not over gesticulate. For facial expressions, your face can say a lot. Paul Ekman in 1972 released a seminal paper about how there's actually universal emotions that people, regardless of language, can recognize. Um, some of these are on the screen here. This was actually the basis or inspiration for the movie Inside Out. So, disgust, fear, joy, sadness, anger are all examples of universal emotions that can transcend language. Other pieces that can really add to your communication is the volume. A lot of times when you're speaking with individuals where um, you're in a space or setting where there's other people, it's important to be mindful of your volume. You can project by using the muscle, your diaphragm, to extend the volume of your voice. Pitch, right? You can fluctuate your pitch to be higher or lower. Typically, lower conveys a little bit more authority, emotions, or sincerity, but you can fluctuate that as well to create a variety in the way that you speak. Rate is also very important. Typically, people speak faster when they're more excited about something or if they're frustrated about something. But it's important to regulate your pace depending on the person receiving the message as well. Articulation. So, this is sometimes tricky if English is not a first language, but it's important that if articulation is a challenge, that you slow down your pace in order to ensure that the articulation of your words come out very clear. So the last piece I wanted to mention was the call to action. So this is a phrase or term that's used very commonly in marketing or social media. Um, and what it's used for is really to create a sense of urgency for the user to take a desired action. And the goal is really to have a clear direction and action from that person. So likewise, whenever we send any message, we really want to think to ourselves, like, what is my call to action? What is the ask I'm asking for? So the message needs to have, like I said, a clear ask. What is an ask? Well, in if anyone here has watched Dragon's Den or Shark Tank, the ask is at the very end of the message, like, I'm here to ask for, X amount of money because my valuation is this blah 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 blah, and I'm going to use it this way. Very similarly, we want our asks for any kind of message to be super clear. So, what am I asking for? When do I need it by? And what is it going to be used for? Clear deadlines and then key contact or questions concerns. So, if you're sending an email, if anyone has any questions or concerns, please contact so and so. Common mistakes that we might see in our messages is something just like, oh, let me know your thoughts, right? Okay, about what? When do you need the thoughts by? Or I hope to hear from you soon, right? I do this a lot too, right? Because it's a very friendly thing, but it doesn't have a lot of direction. A better example would be, please confirm by Friday at 5 p.m. by replying to this email. Or if you want to combine them, let me know your thoughts by Friday at 5 p.m. by replying to this email. Okay, so now that we kind of have the basis for effective communication, I want you to think, and you can tell me in the chat, so who are the key stakeholders that you engage with in your organization? And now I'm coming back and reading the chat to see where folks are coming from. So we have, folks joining us from Nigeria, from cities in Canada, from Uganda, CAMH, guys in St. Thomas NHS Hospital, right? So we have their team size is about 50. Some other team sizes are 30 plus, 20. So, right. So these are fairly, medium to large size, well, medium-ish teams. But for nonprofits, this is a pretty good sized team. Executive directors. Okay, so people are saying they interact with board members, staff, volunteers, patients and families, funders, community partners, patient organization groups, clinicians, right? These are all incredible points, and these are all the key people that we often interact with, patients and families. And depending on your team size, you may be interacting with more or less stakeholders or more number of a particular stakeholder as well, also depending on your role of your organization and what your mission, value, and purpose is. Okay, so really there's two camps or two buckets of stakeholders that we frequently interact with. So I've classified them as like your internal stakeholders and your external stakeholders. So internally, you have your board members, you have your staff members, you have your volunteers, and you have your contractors. Externally, you might have the government that you work with, the hospitals, the patients and families, industry and pharma, funders and donors. I also like the suggestion here that you do have partnership with community leaders, religious leaders, other peer organization, nonprofit organizations as well. So I want you to reflect now. I have a worksheet I'm going to put in the chat. People can use the worksheet if they would like that type of format. Oops. Or if you have a pen and paper, then you can just do it based on the reflection on the screen. So essentially, there's a rubric here on the screen where you score from 1 to 4. the, I guess, the strength of your communication between your organization and a key stakeholder group. So you can rate that relationship, and then you can also reflect on the clarity of your messages, consistency, follow through when you have these messages with these people. And then also, if you have time to reflect on, like, maybe what are the gaps with this relationship or communication pathway, and we'll talk about strategies to improve it soon, but you can start brainstorming ahead of time. So again, I've uploaded a worksheet with this information with boxes for you to fill it out. Or if you have pen and paper, you can do it based on the screen. So what does one mean? It means that messages are often confusing or inconsistent, actions are often missed. Two is developing, so there's some clarity that exists, but expectations, follow up, and consistency are uneven. Three means that your relationship is pretty strong. Your organization communicates well with the stakeholder with clear messages, defined actions, but sometimes there's occasional gaps. And then excellent. Your communication with the stakeholder is very clear, consistent, predictable, with a strong follow through. The stakeholders that I want you to think about are these 10. Uh, Anything that does not apply to your organization, you don't necessarily need to rate it. Or if there are additional stakeholders within your organization, you can rate those as well. So I'll give folks about 5 minutes to do this. And then I'll open the floor for anyone that might want to provide any reflections. And if anyone has any questions, thoughts, concerns, comments, please feel free to put it in the chat. Good question. I would like you to write this down on your end, and then I will potentially I'll ask folks about which stakeholder group needs the most immediate connection or improvement, and then also which stakeholder currently has the strongest relationship. I'll ask that later on at the end of the 5 minutes. So yes, if you can write it down yourself, or you can download the document and you can fill it out, that would be excellent. Thank you very much. I'm just noticing that some folks are putting numbers in the chat. Um, Again, perhaps this is a miscommunication on my part. What I'm hoping for is that you see here, there's numbers at the bottom. So one is board members, two is staff members, volunteers, patients and families, contractors, government officials. For each of these, I would like you to write down probably on your own piece of paper. So for example, with board members, as an organization, I think that my relationship with my board members is probably pretty strong. So I'll rate it as a 3. With my staff members, well, we frequently talk to our staff members. So potentially my relationship with my members are pretty strong. So I'll put a 3.5 or 4 or something if we want to do a point scale. And then let's say, for example, maybe I don't have a lot of community partners. So I might rate that 10, my community partner relationships are developing right now. So I'll rate it as a 2. So I will open up the, I guess, the conversation. So which stakeholders does your organization feel like they have strong relationships to? I see here that someone has mentioned we frequently have clear understanding with our staff members and related CBOs. You might have to let me know what CBO stands for. Community-based organizations is my guess. Another person mentions that 1, 4, 7, 9, and 10 are very strong. So board members, patients and families, community partners, and funders and donors. Excellent. Community-based organizations. Okay. So what about a stakeholder group that might need more immediate communication improvement? Samira says patients and families are probably rated 3 is strong. Communication is clear. Patient-centered. Focus on trust. We'll be glad if you can kindly share the presentation after the meeting. Yes, I'm sure that the administrators of the Gansett team can probably distribute these slides as well as the recording. Okay, so keep this in your back pocket. You know, if you have this piece of paper, keep it because I would like you to use it at a second part. Or if you have the virtual document, keep it so we can continue our reflections. So Nancy says that there's a rating of 2 for her volunteers. Um, for her, it stood out as needing the most improvement because communication can be inconsistent across channels, expectations, timelines, and follow-up are not clearly defined. 3 help with this group. I might need to ask for a little more clarification for 3 help. Or maybe you also mean that with volunteers, you also seek more support as well, or support or communication. Okay, let's keep going. So I'm going to talk about part 2 now about internal communication and how you can strengthen those team relationships. So what is internal communication? It shapes the everyday actions and operations of the organization. If you have unclear messages, we've mentioned now a couple times that it can lead to duplicated efforts, mistakes, missteps, loss of trust. And then when you do have strong internal communication, this can prevent problems before they reach public interactions. So I have a couple strategies to help with your internal communication. Strategy 1 is defining ownership and reducing assumptions. So it's important to have clear ownership of tasks with expectations also being clear. This allows us to make sure that work doesn't go undone and that work is done with accountability. Writing it down can really help as well to reduce the need for follow-up or like consistent emails about like what did we talk about again? And then unchecked assumptions can sometimes slow work or lead to mistakes. So how can you implement this strategy? During meetings, assign your tasks and send out meeting minutes documenting the assignments. Um, and then I add a piece that also at the end of the meeting, you can verbally say, okay, so Chloe, you're going to do the meeting minutes and also do the follow-up with this person. If you say it out loud and then include it in the meeting minutes, then everyone's expectations are pretty clear. In emails, you can also assign tasks, but you have to clearly define, okay, Chloe, you're going to reach out to this person. Another thing you can do as the person receiving the message, you can say something along the lines of, oh, can you clarify what you meant by doing this task? Or can you clarify what you meant by this is needed urgently? Like, what does urgent mean? Or restate what you heard before responding. So, okay, I can email somebody. Should I email them with this or that? Should I CC X, Y, or Z? So asking for clarification in that way. Strategy 2 is create conditions where people can speak up early. So teams that feel respected and heard will typically share their concerns earlier. Sometimes silence can signal fear or overload or past negative reactions, but it's really important that you can get early inputs to be able to have early interventions. So leaders and team culture can really shape whether or not people act in this way. Um, and this can be shaped by how leaders can react to feedback or when things go wrong. So how can you implement this strategy? So often we ask for anyone have any questions or concerns at the end of a meeting? Or if you feel like it's a really big group, you might want to ask someone individually, oh, I saw you didn't really say anything in that meeting. Did you have any questions or concerns? Pause after asking any questions, like give time to people to think if you have the luxury of time, right? And sometimes it takes people different amounts of time to process the information that has been provided. Silence doesn't mean that they're not engaging with the content. Maybe they're engaging in a different manner or time needed than others. Um, Listen actively when team members are providing suggestions. Thank people when they flag issues, avoid reacting defensively, and then implement culturally competent communication practices. So what that might look like is you can do culturally competent training. You can just remind folks that people, express themselves in different ways, might use different languages, might use different methods of language. So just being mindful of these different practices and how that can influence relationships. Strategy 3, consistent, clear, simple messaging. So it's important to repeat key messages on purpose because people absorb information at different rates and times. Keep your messages simple and focused. Um, Communicate consistently, right? Because it's helpful to build trust with predictable communication, and this also reduces anxiety. How to do this? So you can repeat your key points. So in summary, we're going to do A, B, C by next week in meetings, and then in the email again. In the email, you can say we're going to do this by next week. Again, you want to be effective in your communication, consistent and clear without being redundant, and it's sometimes hard to strike a balance for those things. You can set up regular update times using the same communication channels. So anyone that might want standing meetings, right? A lot of times we use this phrase, book a meeting from a meeting. So at the end of a meeting, if you know you need to follow up, don't say something along the lines like, okay, we'll see you next time. Sometimes we forget to book the meeting, and then lots of weeks might pass before we follow up on an action item. So it's usually helpful to end a meeting with, okay, so when is our next meeting? Let's put it in the calendar. Use short sentences and lead with key information. Strategy 4 is use writing, reminders, and systems to reduce your mental load. Everybody has many things going on, and if we can reduce the amount that needs to be like thought of at all times, then this can help our productivity. So verbal agreements are often forgotten. Different methods for similar tasks can lead to miscommunication. So we need clear documentation to reduce repeated questions, and writing supports accountability. So how to do this? Decision or task needs to be assigned, schedule reminders, and then take meeting minutes and standard operating procedures. So here is just a short list of common documentation or standard operating procedures that organizations might have. I'll leave that for individuals to look at when the slides go out. Okay, another reflection question. So based on um, the work that we just did with the previous reflection, right? I asked you which relationship between your organization and a particular stakeholder was the weakest. Now I want you to hone in on which of these internal stakeholders you currently have the weakest relationship with. Options are A, B, C, D. So ask yourself, where does internal communication affect this relationship? Who prepares the messages, the decisions, or follow ups for this group? And where do things usually break down if there is miscommunication? So, for one of these groups, think about these questions and then write down what is maybe one thing that you notice that could be improved, and what is one strategy that you think you can implement to improve that relationship. I'll give you guys 3 minutes to do it, and then we'll take it up. So I see Liu has mentioned C, volunteers. So if you recognize that potentially this is the weakest relationship that you have with the internal stakeholder, what is something that you might want to implement in order to improve that relationship? So Nancy says A, board members. Bashir says B, team members, right? Think to yourself, how might you want to improve that relationship? Does it mean I need more consistent um, messaging, or do I need a system? Maybe it's a systems issue. I need a platform or a process to be able to better organize our methods of communication. Most seems like most folks are, focusing A, B, and C, understandably. right? So I will challenge you to really think about what are some systems, processes, methods of communication that folks can improve. There is a need for us to improve more on our volunteers to strategically improve effective communication, have more consistent updates, clearer follow-up, so everyone's on the same page. Excellent, excellent feedback. Thank you. All right, so I'm going to transition over to external communication, and I am mindful of time, so I'll try to ensure everything's effectively communicated, but also finish on time. So external communication shapes how others understand your organization. Really, it's about public perception and about your relationships with others, and it helps determine your partnership into action and how seriously people can, I guess, how decision makers perceive your work. So I have a couple different categories. The first one is government. So how does the government think? Well, they think in terms of policy, population impact, and risk. Decisions can move through formal processes and timelines. Often because it's so formal, there's a lot of bureaucracy. Things get a little bit slower, right? One meeting can rarely lead to immediate action, but it's about building credibility and long-lasting relationships. So I'll move over to how to communicate effectively with government. So one, build relationships across all political parties. Now, there might be differences between different countries, but most countries have different political parties. It's good not to put all your eggs in one basket. You know, want to build relationships with people across different parties. Um, Engage local representatives. So invite them to community events, help them meet constituents and see local impact. Use formal channels. So with government, you typically need to have a level of formality. So what does that look like? Use official emails. You most likely don't get to communicate with the government official themselves. It's usually through their secretary. So, you know, be respectful of that relationship. Request meetings properly through formal channels. Use the right language, professional, use the titles and honorifics, like such as member of parliament or prime minister or president. Be clear of what you're asking for. Again, these people get a lot of emails, so have a clear ask objective. So am I asking for you to support a bill? Do you want to have a meeting? Do I want you to come to an event? Do I want you to speak for an occasion? Be very clear about what you want and when you want it by. And identify and support champions. So let's say somebody says, you know what, I love your cause. I really want to support you. You know, build that relationship, because when you want to enact a bill, it has to be submitted by some member of parliament or government, rather. Okay, transitioning over to hospitals and families. I've put this together because we really want to focus on building the bridge between hospitals and families, as well as our individual relationships. So hospitals and patients speak different languages. Hospitals might focus on risk management, capacity, and cost. Patients and families really want to be heard, understood, respected, and get quality care and treatment, really. And our goal is really to bridge this gap. So what breaks the communication between these two groups? High stress, time pressure, cost pressure, overuse of medical jargon by healthcare providers, emotional escalation without a clarity or a lack of explanation for decision making. So what does not work? What does not work though? Patients or families escalating emotionally by yelling or taking uh, you know, words out on one particular healthcare provider, or clinicians responding defensively, or clinicians making decisions without actually sitting down and explaining it to patients and families, or if they're constantly changing decisions or medications without explanation. So, what can we do to bridge this relationship better? Potentially, we can create simple tools or resources for patients and families to use. So, one-page summaries, um, or a guideline of what they can do if they've not received proper care, right? Who can they contact? Who can they talk to? You can also take a more proactive approach to avoid getting to those escalated scenarios by setting up patient advisory groups. So bringing patient voices into the system early, flag issues before they escalate, Building relationships with the hospital staff, again, early before things escalate to negative consequences. So, who are your key clinical and administrative contacts? What are some experiences that you can share that people have had in the past and offer insight as to how things might be able to improve? Aligning your message across the staff and partners. So ensure that patients hear the same information or at least similar information or explanation from different sources. This is to reduce confusion and then really to empower patients with the knowledge of how to advocate for themselves effectively. So, what are their patient rights and expectations? How can they effectively and clearly communicate with care teams when they need something? Again, different systems have different barriers. So it's kind of a little bit of groundwork needs to be done by individuals to acknowledge or identify where the biggest gaps are and what action can lead to the biggest impact. With funders now, relationships with funders. So, what are funders looking for? They're looking for a clarity of your mission, vision, and values. They're looking for evidence of your impact. So, your statistics, your reports, how many people you've affected, have you demonstrated success in the past? And they really want to see, will you be responsible with the funds that we provide you? How can you demonstrate that? So, how can you effectively communicate with your funders? Anything you do, you want to track, and you want to track those activities to outcomes. You want to use clear data points or metrics, collect stories, because that can be really impactful as well. When you communicate with your funders, they often have guidelines. So use those guidelines for your reporting. And then to build strong relationships, thank them, maintain timely communications. And then example of how you can tie your activities to outcomes, right? This funding has allowed us to do ABC, which has positively supported number of families. Specifically, as a result, we were able to achieve XYZ. So for example, this funding has allowed us to implement a new program positively affecting 100 families. Specifically, as a result, we were able to strengthen our community, increase level of engagement from this underserved population, which inevitably will help the community as a whole. Okay. Another round of documentation SOPs. This is more on the line of with your external partners. So mission, vision, values, grant writing, budget templates. Your operations would be your contact list, your invitation letter templates, emails, proposals, research abstracts, or statistics. Okay, this is something I want to emphasize. Always collect feedback, right? Feedback is what you're working with. It allows you to make real-time adjustments and improvements. Your data strengthens your credibility and it gives you leverage, right? It gives you leverage to ask for more from different partners. Evidence can also support your advocacy, funding, and partnerships. So, examples of how you can collect feedback, your pre and post event surveys, written or verbal feedback from patients and families you've supported, or healthcare providers you've provided education to, and then also asking for evaluations, right? Staff beneficiary evaluations. How did we do this year? That kind of thing. What can we do better? Summary. So, we've covered really three main parts so far. Understanding your communication strengths and weaknesses with different stakeholders, how to strengthen your internal communication with teams, your external communication with partners, and then really using feedback to build your credibility. Okay, here's a list of resources. I'll just spend a minute or two going through them because right now it's just a bunch of words. So I've tried to find free resources that are not clunky and make you, sign up for a million things. So some resources that might be helpful for groups here is like anytime you want to do a live engagement with somebody, there's Kahoot, which is like polls and quizzes to engage people. Registration forms whenever you have events or you want to do pre and post event surveys. These are all free, SurveyMonkey, Google Forms, so on and so forth. Scheduling meetings, there's tons of ways you can do it for free. These are all examples of softwares and platforms that you can use. Meeting softwares, All examples you can use: team organization and document storage, slide deck creation. This slide deck was made on Canva, but Google Slides is good, Microsoft is good, SlidesGo is good. Learning, there's all these courses that are completely free. Other free resources: project task managers, translation, transcription, writing, research. So research, these are all good, like Consensus, ChatGPT, Deep Research, Research Rabbit. That's all for any kind of like healthcare research, patient, uh, you know, anytime people might be like patient reflections on something. But global statistics and data bank, that's like number of people that are currently on this high protein diet, something like that. So they have data bank, Statista, IBIS World, social media, newsletter, and tracking expenses. That's everything. So I want to say a big thank you. I recognize that we're a little bit over time, but I am going to stay back to answer any questions, and Daniela will put up a poll because, as I mentioned, collecting feedback is crucial. So I welcome your feedback on how we can improve this. My email is here, and then this link is going to the e-course. Again, this webinar was complementary to the e-modules that we created on the Gansett website. So if anyone has not had the chance to fully complete that, this webinar is complementary to the effective communication module. And then there's also many modules and many webinars to come. Thank you very much. I appreciate the feedback that's coming in right now. And yes, please, if you can and do the poll that has popped up in front of your screen.
Yes. Thank you so much, Chloe, for such an insightful presentation. And we can have like 5 minutes for Q&A. So if anyone has a question, they can just drop it quickly in the chat. And I'll also share the link to the modules. So I guess we have one question so far. So how do we rebuild trust after a miscommunication?
Mm. No, that's an excellent thing to mention. And it does happen. Depends on which stakeholder it might have happened with. If it's within your team, typically the repair can be done quite quickly, right? If it requires like retraining of staff members, if it requires clarification on, standard operating procedures or methods of communication, this can be quickly done within an organization. Um, if it's an external partner, right, it's really important to take ownership of whatever happened, right? Your building trust starts with transparency, trust, honesty, and consistency in the words that you use and the actions that you take, right? If you've had good relationships in the past, you'd be like, this is not something that we typically do. We acknowledge that we've making the mistakes. We've rectified systems and processes within our team, and we want to move forward and like do better. If it's something you need to actively rectify, then you actually need to take the actions to rectify it. So, like, as a result of this consequence, we have taken these actions, and you can hold us accountable to that to quantify the impact of these actions. We are doing XYZ.
Okay, thank you. So another question, do you have any tips for improving communication when you're working with limited time and
Yeah.
capacity?
This is a really good question, and it's something that inevitably people will face because the work keeps growing no matter what. It takes time to do this, right? It's a front end effort, but building systems, right? Building systems to kind of catch when communication might fail, right? So encouraging everyone on your team to calendar invites. Example, if everyone does that, or to take meeting minutes, or to follow up, or to respond when you send out a can we meet. If those systems are in place, you're less likely to have people missing meetings, likely having to things over and over again. Another thing is like if you house your documents in a centralized system, it also prevents you losing things and needing to redo things if you have a bank. So again, unfortunately, that's like a lot of front end effort. But it's easier to set up those systems than constantly have to build the plane as it's flying.
Okay, thank you. One last question. How would you suggest handling communication when different stakeholders prefer different channels?
Okay. Yeah, that's a good point. So As much as you want to accommodate, right? You want to accommodate that people have different preferences and communication styles, or there might be an accessibility issue, and that people prefer to, um, for example, use WhatsApp over email. Then make a note of it in your standard operating procedures. Make sure everyone's doing that. Make sure that you're not missing text messages or emails because you're checking one mode over the other. But if, like we mentioned, we have a capacity issue, then it might be helpful to do training and say we're going to use this method for this type of communication. With when it's with external partners, is a little bit more tricky. It's better to maintain trust and build relationships by accommodating to the type of communication channel. But if you have built that trust, you can ask them like, hey, would it be okay if under these circumstances I give you a call or text instead of email? As long as you establish that and you don't, cross boundaries without without permission to, then it should be okay.
Okay, one final question, and this is off topic, but I feel like it's very
Okay.
important. So, the attendee asks, my NGO is newly founded, birthed from a beta experience. How best can I
Mm.
develop a smooth running of the organization all round?
I think the wonderful thing is that because you're a brand new organization, you can learn from past mistakes, right? You're also at the junction of an era where like you have like so many tools at your disposal to help with efficiency of the organization. You're setting up your systems for the first time, right? It's harder if you're trying to um, move old systems to new systems, but you're at the very beginning. So you can kind of capitalize on this moment. I think the hardest thing for you right now is that if you are a new organization, you probably have limited capacity in a small team. So it's better to pick your team wisely and have a quality team than to have a lot of people who don't know how to communicate well together, right? Build a strong infrastructure of like maybe two people that know exactly what they're doing, and then you can build on that so that everyone in your group, when you build a larger organization, is kind of on the same page. That's my 2 cents. If anyone else here, because I'm sure there's lots of people here with experience, they can also feel free to chime in and provide experience or insight.
So that was very, that's a good answer. And I'll also suggest they can take the tools that we have because it kind of
Mhm.
gives you a good
Exactly. We have one module
foundation.
called volunteers. Yes.
Yes, it gives you a good foundation on how to even build your organization from the ground up. So we have on even communicating with donors, project management, volunteers management, and yeah. So let us know. Take the modules and let us know. And you can always reach out to Chloe or Gansid
Mm.
need any help. So that's it for today. Thank you everyone for joining us. And we will see you again in April because we hold it every quarter. So thank you for being part of today's conversation. And thank you so much, Chloe, for your time.
Thank you, Daniela.
Okay. Bye, everyone.